Hello, everyone, and welcome. Uh, I'm just going to give everyone a few minutes to filter in, but we are so delighted to have you join us here today at the Global Institute for Women's Leadership in partnership with the Department of Foreign Affairs and Trade and Investing in Women, and also working with our phenomenal research partners, NDRI, PIDS, and SMERU. For this launch of our report on investing in care, investing in women, looking at the future demand for care across Southeast Asia. Now, today is a really historic moment for us. We are gathered on a very significant day, International Day of Significance for Care, and we are here to launch this report that has been over a year in the making and a really important landmark study when it comes to looking at demands for care over the next 25 years across Philippines, Vietnam, and Indonesia. To mark this and to start off, I would like to acknowledge the traditional owners of the lands on which I'm joining you from here today, Ngunnawal and Ngambri country in Australia. This is a common practice we have in Australia of recognising the people on of the lands that we are meeting on or coming to you from, and to acknowledge that history, elders past and present, and also pay our respects to First Nations people who might be joining us from Australia or who might be joining us from across the region. Now, I'm Dr. Elise Stevenson. I'm the Deputy Director of the Global Institute for Women's Leadership, and it's my privilege to be able to contribute and lead this study on investing in women from the Global Institute for Women's Leadership team at ANU. Our team is a pretty diverse team. We're interdisciplinary researchers. Our institute was founded by the former Prime Minister of Australia, Julia Gillard, who is our first and only to date female Prime Minister. And we exist to do all kinds of research at the forefront of gender equality, policy, and practice, not just here in Australia, but across our region, and hence our deep commitment to this project funded by the Department of Foreign Affairs and Trade, working with investing in women. I'd first like to start by saying my big thanks to our funders and to our key partners. So working with the Australian government in investing in women program is a long-standing collaboration for us, dedicated at looking at gender equality as well as economic equality across our region. We've also been able to produce this research through many local partnerships. So the Mekong Development Research Institute, MDRI, in Vietnam, Philippines Institute for Development Studies, PIDS, in Philippines, and SMERU Research Institute. And I want to say a very big thanks to our local research partners for being with us on this journey and for contributing to such a robust study. I also want to thank the audience, wherever you're joining us from here today, across Southeast Asia or Australia or the globe. We welcome you. I think that this is a really important moment for us to look at kind of the next 25 years going forwards, and what is those really important drivers and trends that we're seeing that can help us meet the challenges of the rising demand for care, as well as what it looks like to do so in a gender equal manner. So before we kick off, we've got a really action-packed schedule today. So I am going to be handing over in a minute to the phenomenal Mark Bailey, who's a Director of Southeast Asia Gender and Human Development at the Department of Foreign Affairs and Trades, to give some opening remarks. I will then launch into a little bit about the study and what we actually found. We'll include some links to the report so you can go and check it out live. We are then going to go to a moderated Q&A session, and I will be inviting some of our lead researchers from our local research partners to answer some questions, and then we will be going to an open Q&A. Now, there is a Q&A function. If you are looking to ask questions of our panel, we would really welcome it, and you can see that Q&A function on the Zoom bar. Please ask questions. And we'll finally wrap up. We'll have Maisie Angelina from Investing in Women to deliver the closing remarks. But without further ado, I would love to introduce Mark Bailey, as I mentioned before, the Director for Southeast Asia Gender and Human Development in the Office of Southeast Asia from the Department of Foreign Affairs and Trade, to deliver the opening remarks. Over to you, Mark.
Elise, thank you very much for that warm welcome. Good afternoon from Canberra, and good morning to our speakers and attendees joining from Southeast Asia. On behalf of the Department of Foreign Affairs and Trade, It's my privilege to welcome you to the launch of the report, Future Demand for Care in Indonesia, the Philippines, and Vietnam. And at the outset, I'd also like to associate myself with Dr. Stevenson's acknowledgement of country and pay my respects to any First Nations people joining us this afternoon. Australia is proud to support this report from Investing in Women, the Global Institute for Women's Leadership, and its local research partners, Semeru Research Institute in Indonesia, the Philippines Institute for Development Studies, and the Mekong Development Research Institute in Vietnam. The report brings a multi-stakeholder and longer-term perspective to underscore a powerful and well-established fact that advancing women's economic equality and investing in the care economy are central to securing Southeast Asia's future prosperity. Australia's recent International Gender Equality Strategy, launched by Australia's Foreign Minister at the start of this year, recognises that unpaid care and domestic work remain a key constraint to women's economic equality. And this is seen globally, that women still carry disproportionate caregiving responsibilities, making it harder for them to fully participate in the formal workforce. Care services constitute critical economic enablers and critical part of the economic infrastructure. And I think we all experienced this during COVID, where access to services and the service workforce was critical. And we found that formal, professionalized, innovative, and long-term care solutions can boost women's economic participation. They can also transform gendered stereotypes relating to caregiving. This report tells us that the quantity, quality, and complexity of care will change over the next 25 years, given demographic and economic shifts in Southeast Asia. Across the region, we see key changes such as a growing middle class, also an aging population, accompanied by increasing disability prevalence and declining fertility rates. Other factors, such as urbanization, vulnerability to climate change, and migration, which are playing out in different ways in different countries, will also shape public responses. Taken together, these changes have significant implications for the region's productivity. The report also identifies several promising levers to address future care demand. For example, professionalizing care services through education and skills training can deliver both dignity and higher incomes for care workers. Digital platforms that match families with qualified caregivers demonstrate how technology can expand access to formal care efficiently and at scale. And community, home, and facility-based care infrastructure can help families access reliable care close to home and work in urban and industrializing areas. Strategic investments in the care economy can serve as a catalyst for deeper economic cooperation and shared prosperity between Australia and the Southeast Asian region. This is core to Invested, Australia's Southeast Asia Economic Strategy to 2040, including its focus on the care workforce. We welcome the report's recognition of the private sector as a key player, not only as service providers, but as employers with the capacity to create inclusive workplaces. Across the 3 countries studied, we see solutions such as employer-supported childcare and flexible work arrangements, supporting more gender-equal caregiving. Finally, this report reflects the strength of research collaboration across our countries, bringing together diverse expertise and fostering people-to-people connections that underpin lasting partnerships and shared progress. So to sum up, I'm really looking forward to the sessions ahead of us and the discussion. So I will pass back to Elise. Thank you.
Thank you so much, Mark. And I think you foreshadowed very nicely some of the findings we're going to be going through today. To launch in, I just wanted to start with a big thanks to our phenomenal research team and acknowledge in particular Dr. Dika Medikawati, who led the research from our GIWL end until very recently, as well as Dr. Tia Nguyen, who has joined us as research coordinator at Investing in Women, and our broader research teams from all 4 institutes who are involved in the research. We truly couldn't have done it without such a collaborative effort. But to get into the details, so I'm going to talk through the agenda, talk through the introduction briefly, our research design and methodology before going through some of the key research findings. If there are any that are particularly interesting or relevant to you, keep it in mind. And if you've got questions later, please do add them in the chat. And then I will conclude and we'll roll on to the Q&A. To start with, though, as Mark mentioned, understanding the future care demand is crucial for guiding our strategic investments in the care economy. And post-COVID, when we've all lived through kind of the competing pressures on our care ecosystem, we know that this is much more important than ever before, or it's being recognised as much more important than ever before, which is a really important moment and a really significant opportunity. So given this, our research really contributes to examining the future demand for care, looking at that 25-year horizon, which is an established kind of horizon amongst demographers and other researchers, as being a really critical timeline that we can influence and in our kind of immediate to medium-term future. We're really focused on a gender transformative approach, which means addressing the care needs effectively in ways in which promote gender equality and avoid reinforcing existing inequalities wherever possible. As such, we apply a gender lens, and the gender lens really helps us to understand the impacts of care challenges, particularly when it comes to women's economic equality and participation. So we see statistics such as globally 708 million women being excluded from the labour market due to their unpaid care responsibilities, and women performing on average 2.5 times more unpaid care work than men globally. So looking at kind of a gender responsive or transformative care economy also really requires and enables the development of gender inclusive care policy, which brings really strong social and economic benefits. So not just for individuals, we're talking about broader women's labour force participation, closing care gaps, expanding services, and reaping both economic and social rewards. In order to do this research, we really wanted a collaborative and co-designed approach. So our study has built on an earlier landscape analysis that we did a few years ago, which looked at kind of the drivers of the future demand for care, private sector role, and barriers and enablers. And for us at GIWL, it was a real pleasure to be able to lead this research consortium with SMERO, PIDS, and MDRI. We came together, we had a broad structure of what we wanted to achieve, but we co-designed approaches to ensure that there was a shared framework for research that was relevant to each of our countries' contexts. So looking specifically at the Philippines, Indonesia, and Vietnam. We felt this enhances relevance, quality, and also national level policy impact. We had 7 main questions that looked at things like what are the demographic, social, and economic transitions? How are views on cares and its links to transitions changing, and how are they perceived in society? What are the demands for care? What are the expectations from institutions? How are institutions responding? How is the changing demand for care impacting on women's economic equality? And what are the implications for public and private sector alike, as well as for international, NGO, and local community sectors? We have come to this project with an intersectional feminist approach and drawing on the UN Women Toolkit, which looks at paid and unpaid care to look at kind of the 6 R's. So recognition of unpaid care workers, visible and valued, trying to reduce, kind of lessening those burdens and time consuming nature of unpaid care, redistribute care equitably between genders, addressing issues around reward and how care is valued, and working conditions. Representation, ensuring that care workers have a voice, and resilience. So adopting systems that can actually adapt and withstand major crises, which is increasingly important in a very digitalized world, but also a world grappling with climate change. Our methodology was mixed methods. So as mentioned, we primarily focused on gender, but we brought in intersectionality. So looking at rural, regional, disability, ethnicity, other factors that might be overlaying and impacting on gender equality and care. We looked at drawing from our previous definition of care, which is aligned with the ILO, meaning that we focused on both paid and unpaid care, direct and indirect care. And we really focused on multiple different ways. So on childcare, on aged care, and on care for people with disabilities in particular. What was out of scope was healthcare and medical kind of care services. We really focused more on these three types of care as they kind of fit with the study. And we were really interested in how are things shifting. So across support for children, older people, and people with disabilities. We conducted interviews, focus groups, and validation workshops across the 3 countries from just over 300 participants. After we had all this data, we thematically coded it and then triangulated findings using secondary data insights. So what did we find? Looking at some of the key demographic, social, and economic transitions first, we identified 8 key factors that were influencing care demand. Now, I'll note these aren't exhaustive, but we really wanted to pay attention to what are the primary drivers that we are seeing influencing care. As Mark mentioned, we do have declining fertility rates, but we also have an increasing proportion of older people and higher rates of older people living alone that mean that our population structure is changing. Alongside this, increasing disability prevalence is witnessed, which is both related to age functional decline as well as higher rates of earlier diagnosis in children. This contributes to a higher demand for care support and more quality, tailored support. Migration is also a factor alongside a growing middle class. We do see some evidence of gender norms change around care as well, whilst care does largely remain the responsibility of children, of women. This is changing across the region. We know there are also labour market trends and policies that are also influencing care demands. So this includes increasing rates of women's education and labour market demand, which is likely to drive greater need for paid care services, particularly around childcare as women enter the labour force. Climate change and climate-related disasters, we are already seeing a disrupting care infrastructure and disproportionately impacting vulnerable groups. And tied into all of this is an overarching trend amongst governments across our region that have aspirations for growth. So higher labour force participation, higher economic output, more robust economies. Now, this all are really important drivers that will influence care demands and care needs. So these shifts, they interact with each other. They're not just seen in isolation, and they can also be impacted by things that haven't been widely anticipated. Unexpected disasters and emergencies and events. But what we do see is things like population aging linked to disability prevalence, gender norms continuing to place burden of care on women, which influences labour decisions, meaning that this is quite a complex topic to study. We know that as these shifts increase care demands, this will place greater strain on women to perform unpaid caregiving, and that we have some risks associated with that. So women's economic equality remains unsupported when unpaid care burdens fall disproportionately on women. We do see low rates of women's labour force participation, particularly across Indonesia and the Philippines, which means that nations could be failing to adequately benefit from these highly educated women who remain critically under-supported to take part in the labour market, but also to manage care responsibilities at home. So when it comes to transitions and links, we see that women are still overwhelmingly expected to perform care, and that this cuts across all different themes, from care of children to aging parents or spouses, in-laws, and people with disability. We also see that the redistribution of care is driven much more by economic necessity rather than deliberate efforts to shift gender norms. So high costs of living are necessitating dual income households, which lead to redistribution of care responsibilities to a degree, which includes the increased involvement of men as well as outsourcing. So this redistribution is driven by economic necessity, but it does open up a lot of important questions. For instance, if we are outsourcing care, to whom? And are we continuing to outsource care to the same kinds of people? Perhaps women are in other circumstances that are less better off. How can we help to professionalise care sector and support those who are working in the care industry, as well as ensure that kind of existing inequalities aren't perpetuated? So we see that there is a strong preference that persists for informal and family-based care. So when it comes to childcare, for instance, in Indonesia and the Philippines, many families prefer to keep their young children at home. In Vietnam, a low childcare uptake, primarily due to lack of available facilities rather than parental preferences. And that we generally see this trend. Women's labour force participation tends to dip during childbearing years and then rise again as women grow older. So being able to support women and families across that journey is really, really critical. When we see care for older people in the Philippines, we see this as being mostly out of pocket. Finance for outpatient and long-term care services, rather than seeing institutionalized care, I guess, as being more common throughout. It's more common amongst affluent households. Across all countries, the low take-up of formal residential care is often due to cultural norms of family-based elder care, such as feeling debt of gratitude or filial piety, and affordability is also a key barrier. When we look at barriers to uptake of formal care services, unaffordability remains common, particularly across childcare and care for older people. We also see for childcare limited operating hours and lack of options for children under 3 years. For caring for older people, strong cultural norms and limited supply of professional caregivers. And for people caring for people with disability, we see that frameworks tend to emphasise I guess, people with disability having dependence on care rather than looking at their own autonomy and decision making. And we also see mistrust and negative experiences with living care. A lot of these themes reinforce that it's not just accessibility and affordability that is an issue and a concern, but quality of care and how that is changing and needs are evolving. Demand for care is growing across all life stages and demographic groups, which remains the key overarching factor. So expectations are shifting beyond providing basic access and basic services in childcare towards high quality early education. And that demand isn't just limited to high income households. We see that for older people, care needs are expanding beyond physical health to also include much more focus on mental health and social engagement. And for people with disability, again, as mentioned, much more support needed for personal development, autonomy, and inclusion. So there's a strong expectation that the government should provide this care-related support, and we see examples such as expanding disability-related support and coverage for social pensions for older people in Vietnam, subsidising childcare and adoption policies to support working parents in Indonesia, and expanding early childhood care facilities in the Philippines. And again, this need for quality care coming up very strongly in our research. When we look at institutional response across the 3 countries does vary from unestablished to highly established frameworks. We see that whilst Vietnam currently lacks an integrated care economy framework, it does have separate action plans that target specific target populations. We see the Philippines leading the development of a national care economy framework, but no accompanying action plan yet. And Indonesia has both a care economy framework and action plan, but we're yet to see how implementation plays out. So what we see across all countries, though, is the need for integrated roadmaps or national frameworks alongside action plans, with investments relating to care coordinated across several, often quite disparate and differently operating ministries. And this has been really critical to effectiveness. And without such a clear framework, we risk seeing fragmentation in the sector, as well as not being able to support the private sector in order to kind of take up a greater role in this space. So what we see in terms of responses, we see employers have a huge opportunity here when it comes to leave policies, flexible work arrangements, and on-site facilities that might relate to care. For government, this critical policy infrastructure remains very important. So providing incentives to encourage businesses to implement care programs or changes to the way work is done that support more manageable care. Provision of subsidies, setting policies, programs and standards, particularly around quality of care and professionalisation of care industry. International organisations have a really important role around providing technical assistance, research and piloting and scaling innovative care solutions. And startups providing a really important spot in introducing innovative services that can expand into the broader care ecosystem. When we look at some of those enablers and barriers, on the good news, the care economy has emerged as a critical priority under ASEAN's comprehensive framework on the care economy. And there is always much more being done about care in the region. So this is a priority, and this is, I guess, really important momentum to build on. We also see rapidly rising care demand that is prompting action, and community-based care solutions are growing with government support. But some of those barriers are, as mentioned, so cultural reliance on family-based caregiving, challenges across cross-ministry coordination, government budgetary constraints, the exporting of care workers overseas, and also a lack of comprehensive data to map demand and supply of existing care services. Ultimately, this has ramifications for women's economic equality and labour force participation. So rising demands for care are going to particularly constrain women's participation in formal employment due to time poverty and unpaid care burdens. This strain is likely to intensify, which has quite grave ramifications on nations who may be failing to utilise this critical investment, as well as being to the detriment of women and the economy. On the other hand, increased investment in care infrastructure can go a long way to alleviating unpaid care burdens, as long as it is also paired with fair wages, legal protections, recognition of care's skilled work. And this ties in again to the professionalisation of care to elevate both its value and its kind of view within society and remuneration. So national legislation and workplace policies from private and public sector can be really, really important to this. And keeping in mind, there are additional intersectional considerations that will mean that the actions that governments and private sector take will need to be quite nuanced and tailored. So low income and rural women often face compounding barriers, not always being able to afford existing paid care services, or because they are the ones providing care solutions for higher income households. We see women with disabilities or those who care for people with disabilities facing unique challenges balancing caregiving and economic participation, and migrant women facing greater challenges accessing care support, lacking nearby informal networks or being unfamiliar with the access available. And all of these factors are complicated when you throw in natural disasters and other unplanned or unscheduled crises. At the end of the day, having a roadmap and action plan for the care economy signals strong government commitment, and this government commitment can encourage broader engagement from private sectors and other stakeholders, which is really important to driving action. However, we know that effective implementation and cross-collaboration is particularly key to ensure that our our kind of approach to dealing with rising care demands doesn't just perpetuate existing inequalities, but rather can alleviate them. So, given the limited fiscal space that all countries are operating in, leveraging the private sector is a really critical aspect. So, increasing private sector involvement improves or requires improvements from the overall regulatory environment. And we offer some insights around targeted policies that might stimulate investment. So, offering tax incentives, subsidizing land acquisition, simplifying licensing, providing land-related support, and providing clear guidelines, ensuring transparency and reducing administrative barriers. We also see additional benefits. So startups have a role to play innovating in that broader care ecosystem for communities, providing community-based care alternatives, as long as we don't over-rely on communities to do everything at the expense of the private and public sector also stepping in to support. And international organisations, in particular, supporting that care work professionalisation, drawing learnings across from other countries, and ensuring that best practice opportunities are able to be pursued. We go across a whole lot of more recommendations that I recommend you check out in the report. But overall, we see the future demand for care as being complex, non-linear, and largely uncertain. There are key drivers that we have identified that are likely to make a big impact and that governments, private sector, and communities alike should keep in mind. And we also provide ideas and frameworks to help organisations assess how they can meet these rising care demands in ways that is gender transformative, in ways that elevate gender equality, support women's economic equality and labour force participation, and the social and economic well-being of their nations. We see this as providing huge economic benefits, but also being really critical to underpinning a fair, sustainable and inclusive care ecosystem. So I think that I'm going to leave it there, but now I would love to be able to jump into a discussion with our phenomenal panelists. So I'm actually just going to see if I can get some support from the team just to close this down and get everyone up. Give me 1 second. Alrighty, so I might hand over to our three wonderful panelists who are joining us today. And can I get each of you to very briefly introduce yourselves, and then starting off with a question, which is why for each of you and each of your organisations, why is addressing care so important? What is at stake here and what is there to gain? So I might hand over to you, Aubrey, first.
Yes, thank you, Elise. Good morning from the Philippines, and good afternoon to our colleagues and partners care is vital to human development for our nourishment and daily sustenance, among others. And as you've mentioned, there are numerous transitions going on, and this really calls for more proactive approach. So whatever challenges that we are facing today can easily deepen in the future if we don't make the necessary policies and investments today. So what is at stake here? It's no less than our future, our ability to achieve inclusive and sustainable development. So, for example, if we don't address the current and future needs for specialized services, for instance, for children with disability, like timely diagnostics and intervention, they will not attain their full potential, and they will rely more on their families and, of course, on women, and also for welfare programs in the government. So it will be even more costly in the future for the society in general. Another example is that if we don't invest or facilitate the investment of care facilities, including, say, resident and non-resident facilities or other care solutions that can provide care so that women and other unpaid care workers can have better economic participation, then there will even be greater weight on families. And families in the future will eventually shrink. And so societies like the Philippines, which rely heavily on families for care, will face even greater challenges in the future. So I think that mindsets must change because we need to eventually adapt to the situation.
Yeah, thank you so much, Aubrey. What about for you, Hung, from Vietnam and from kind of your perspective or MDRI? What do you see as this being so important, or why is it so important? What is at stake from your perspective?
Okay, thank you for your wrap up of our extensive research. So hello everyone, my name is Hương again. So I'm from Vietnam. I led the component in Vietnam. And just to come up right to your question, of course we know that care is important, right? We all need care, and we all do care of the others. And also, if you look at the context, the demographic context, aging is still unavoidable by now, unless we can have some medicine to revert that, but which is another barrier as well. So basically, because so from the findings, for example, where I talk to young people, they will keep working to take care of their parents, take care of children. Some of them don't even have any idea of how they will take care of them, of themselves in the future. And also for individual people, now the tendency, as Aubrey just mentioned, is also similar in Vietnam as well. There's a tendency of people living alone. Then there's the landscape, a scenario in the future that will be aging alone and together. Then how can we address such scenario? So basically for us, I mean, for me personally, when I received this project, it's more like I'm researching for my future. We're going there anyway. And also that's why I'm interested in this at the beginning. And then throughout the project, it was like trying to discuss with people options, if they see options or not, if they see they have any options in the future. And if we don't look at that future, that scenario, then we don't know how to prepare the options, suitable options for different types of groups and age group and people. So basically, if we prepare better, then we can proactively move forward and not to be so pessimistic or to be over optimistic at the same time, because sometimes the economy just be so much optimistic about the future that we can take care of people, but well, come on, we have barriers to address, right? So that's why I think this kind of research would give a lot of information for policymakers to rethink the agenda.
Yeah, thank you so much, Hung. Absolutely. I think it is so critical because I think there is the real for all of us, right? Childcare, elderly care, people with disability, this is a reality for all humans. So I think that very valid point about kind of caring for the future, but then the kind of large scale factors there around how our society and our economies actually grapple with these really pressing considerations, which go to the heart of whether we can cope with whatever crises and challenges lay ahead of us, our ambitions for growth and our kind of intentions going forwards across whether it's digital technologies or other industries that we might be hoping to develop in. Care really is at the base of everything. It's at the base of innovation and kind of societal thriving. So yeah, thank you so much. Utari, what about from your perspective? And please do introduce yourself as well.
Okay, thank you, Alice. Thanks for the question. Hi everyone, I'm Utari from Semeru, Indonesia. So in the case of Indonesia, I mean, comparing to other fellows from the Philippines and Vietnam, Indonesia is such a big country, and it's projected that the older population in Indonesia will increase. In 2015, it was around 22.99 million, and then it's projected to become 63.31 million in 2045. If we don't have such a comprehensive plan on how care economy works, like in an integrative way and holistic way, this I personally don't like to use the term burden, but in a way it will cost all of us a lot, not only on women, for example, but also on the economy as well, because of the resources that it's not managed well. And just like what happened in the Philippines and Vietnam, in Indonesia, the current care system is also heavily dependent on families, especially women, to fill the gaps. And then in our discussions when we went to the field, women shared how caregiving pushed them or forced them to leave their formal jobs, and then and because of that they lose that kind of protection because they don't have formal occupation anymore, and why they leave the formal jobs because they have to support their families while caring for children and older parents. So in a way, if this issue is not managed in a holistic and inclusive way, starting from now, we from Smeru believe that inequality will actually grow, especially for women and women from a lower social economic class, who in this case, they are usually the one who supported women from more affluent economy to, to stay in the labor market. So addressing future care demand is not just about meeting needs, it's about protecting women's economic participation, reducing inequality, and also building a fairer and then more resilient society. As you mentioned, Alice, that when like the big thing happen, a disaster, for example, we need to be resilient.
Yeah, thank you so much, Chitari. And I think you're starting to touch on my next question, which is really around what insights or findings struck all of you and your teams the most when you were engaging with local research participants. And of course, you know, across the research, there was interviews, surveys, focus groups. We talked to everyone from those who were care recipients to caregivers to institutions, to the private sector, to government. So really broad swathe. So very interested in kind of your key findings or insights that really struck you. And I think if I can share briefly, one that struck me was, you know, through this process, I've had a lot of conversations with people who work in this sector and many who don't. And one thing that's really interesting, Global Institute for Women's Leadership at King's College London, our sister institute, does a lot of research into gender norms across kind of globally. And we are seeing trends around declining fertility rates in many countries, and this was something that also came up in our research. I had questions from people who I was working with saying, hey, but doesn't it mean if you've got declining fertility rates, there'll be a lower demand for childcare? And actually what we see is the opposite, because we're already, I guess, operating from a deficit. And I think that that's a really important point to start from. And we have, I guess, normalized care as something within the home and predominantly undertaken by women. Care, unpaid care, isn't classified in most GDP analyses. It has been highly undervalued at that real kind of structural level, which makes it very hard to put place of value on the work that is done. But now when we're in this kind of situation where we've got declining fertility rates, but increasing older population and increasing disability prevalence, and we're coming from a place where we don't have a lot of institutional support that's outside the home, I think that was something that really struck me, is that we can't kind of just rest on some of these trends that we're seeing and say, oh, well, look, it'll all sort itself out. It's kind of things that we've got enough time. It's okay. You know, we'll build up to it. Or, you know, I guess, yeah, it's complex, but I think that there's a real need, because we are starting from an institutional deficit and there's much more kind of a gender equality deficit. There's much more opportunity to go. But I'm going to hand back to you, Yutari, maybe first. What kind of struck you most when you were engaging in this research?
Okay. This is actually a very difficult question, to be honest, Ellie. So we have to go back to the start with the research team. So we did the reflection to try to understand what is actually care work. So it's very fundamental to understand this first, because when we went to the field and we talked to the key informants and also talking with the community members, we were asked the same question as well. Even some key informants, those from the local government, even asked us whether what we wanted to know is about nurse, for example, like the certified nurse, those working with the GPs. So this led us to deeper conversation with the key informants from that level about the broader care economy. What is actually care work and care economy? Even we, in some cases, we discuss the care economy roadmap when the time allows with them. Across all locations, we went to 3 areas in South Jakarta, Yogyakarta, and Padang in Sumatra. We saw a clear pattern that women, especially daughters-in-law, and female relatives, they are expected, they're assumed to be the primary caregiver for older people and persons with disabilities, and definitely for children. Men may help, but women carry the bulk of the responsibility. So family-based care is still the idea of how you should support your family members in terms of providing care. We selected West Sumatra in particular because of its matrilineal culture, hoping to see a more equal division of care roles, because they say, you know, like in matrilineal culture, the heritage will come down from the women to the women. But then actually when we were there, we learned that the patriarchal norms are really strong. Even religious interpretation also has role. Women were still expected to handle domestic care and tasks. And if you, for example, you don't take care of your older parents, this is where the religious interpretation is also very strong. We have to acknowledge it, and actually also we have to use it to understand the society in order to develop like a care system that support them. Because there's a saying that if you don't take care of your older relative or parents, that means you are sinned. So that's another thing that we should remember when we think about what kind of care provision that we can offer to the people. And then one of the most powerful findings is how participants, especially women doing unpaid care work, felt that finally they were heard during our discussions. Many shared how caregiving takes a toll, not just physically, but also emotionally. And then the male participants who had cared for family members, usually because there is no one else or no female relative that can take care of that task, they also express their surprise at how demanding and draining the work can be. So these responses show how care work has been taken for granted for all this time. And then that also means we still have a lot of work to do. I think I stopped.
Thanks so much, Chitari. What about you, Hung? Was there anything that particularly struck you from the research or surprised you even?
So I think that there are so many things. So it's difficult to select, but because I just got an idea from your presentation, I also just want to take this opportunity to clarify a bit, because for the audience. So I know that the presentation was shortened and to save space. So there's one point that you mentioned about childcare and women's participation in the workforce. That link was a bit of a global highlight for me when I did this research. We know that Vietnamese women participate a lot in the economy for long, but we haven't really thought exactly why and see that connection clearer until I got into this research. And I remember a conversation with Dika. I think Dika was here as well today. She said that she went to the Museum of Women in Hanoi and found out why. And I was like, why? Like, what do you see in the museum that let you think that? And she talked about the war and how Vietnamese women just had to work for living, basically for history, that it becomes a norm for them to go to work. At the same time, they have to take care of children as well, and also other people in the family. But the difference when we put data together with Philippines and Indonesia is that the enrollment and the childcare facilities in Vietnam, and also opening hours of childcare facilities, are pretty high compared to other two countries. And that partially why Vietnamese people have more opportunity in terms of time to get to work. So I just want to clarify the point in the presentation when you mentioned that the reason for low uptake to the to childcare services in Vietnam is primarily because of the lack of facilities. Just to clarify that that's true, but that's true for facilities to take care of children outside of normal working hours, and also especially in industrial zones, areas where they only have access to public facilities. So in terms of coverage of public childcare facilities, Vietnam is doing great. Nearly every commune would have at least one. And now the commune has become bigger, so at least two or three childcare facilities, public institutions are available. So the coverage is there. But the opening times, of course, that would be office hour. And the parents, they go to work at office hour. So if that fits, that's okay. But for workers, they often work in shifts. So if they have night shifts, then it's very difficult for them. Or if they work later than office hours, so that the barriers somehow, especially for workers, for young workers who have lower income to access private facilities. So that's the meaning of that term. So it doesn't mean that it lack of facilities dramatically in Vietnam. So yeah, I was struck when we looked at that data and how to see the link, and also to see that the country is doing well in one aspect, and there's opportunity for them to improve in another. Yeah.
Yeah, and actually, Hung, it's a really good point because, you know, we could have done a single country study, or, you know, we could do a global study. But I think the value of comparison is really, really important for being able to say, this is what each country is doing. What can we learn from each other? Because I think that the really important point here is that there's actually nowhere in the world that has got this right yet, right? So everyone is trialing, everyone is, you know, to a degree, you know, making policy or innovations or, you know, tweaking with their practices to see what can actually support our society economically, but also socially. And I think that this is the real value in doing this research. And I think the value in investing in women's work as well, because I think that where we are able to take countries that may be similar on some dimensions and maybe different on other dimensions, we can actually strengthen and pull out some really specific, deep insights, but also be able to say, oh, well, would that work in this context, or how might it differ in this context? So thanks for pulling that out, because I think that really reinforces for us what some of the motivation was about doing this cross-comparative study in the first place. But what about you, Aubrey? What did you find that really struck you or maybe was surprising about the research?
Yeah, there are a lot of similarities with what Otari has mentioned. If I may just start with the concept of care work, because we also had some issues during the discussions with our respondents. So for instance, when we asked the men if they're doing unpaid care work, they would ask us, what is unpaid care work? What if they're doing some complementary works alongside the women in the family? So for instance, because we came across this equality in doing things, and so they would say that they don't really view it as not doing something for the family. So if you look at the traditional Filipino, like a rural area, rural family, the women would do the cooking and the washing, but the men would do the fetching the water and like cutting the woods, for instance. But they're also doing the farm. So it's more about conceptually developing care work so that we can have like a clearer understanding of the differences that men and women do in terms of the unpaid care work. I've also have realization when it comes to thinking about how can we design services or programs so that we can encourage more our elderly members in the household to avail of non-family or maybe the paid care services. But then when we were talking with them, the caregivers, we we got the information that there's also an agency of the elderly person, and so the reason why they're not availing for like paid care services is that the sick elderly would prefer family members to look after them. And that's because the care needs are not just, the care itself, but the social emotional needs. The happiness that they have, they seem to be more healthy when they're surrounded by their family members, and they're not keen on trusting strangers. That's why even in the rural areas and in the urban areas, they prefer to get paid care workers from their provinces or from their extended families. So because there's really a trust there, and of course there's the preference of the one that's needing care. So when I was like looking at this from a like a policy standpoint or program design standpoint, it's really important to also look at the agency of the one that's needing the care. The other thing that struck me also is that um, in interviewing caregivers of persons with disability, we realize that the if one member in the family has severe disability, things can be really difficult for the entire family, regardless of their economic circumstances. So this is not just, financial. Addressing the care needs of PWDs is not just, in the financial aspect, but also the emotional aspect. So here we really need mental health interventions for families. So despite the presence of some programs in the Philippines for PWDs, their dire situation, really requires more and specialized and more targeted support.
Yeah, thank you so
Thank
much,
you.
Aubrey. And something you just said then, I think also really resonates. One of the big points of this research, I think, is yes, we want gender equality in care, but it's not enough, I suppose, to get equality if the whole care system is pretty bad to start with, right? Like, it's not great. I think we are also looking at a reality where the cost of living means that dual income family is the norm, much more so than in the past. That there are pressures on families left, right, and centre, to work, to raise kids, to look after elderly parents, to contribute to society, to, I don't know, not fall down the trap of mis and disinformation, to adapt to climate change, to learn new skills. There's so many different pressures. And I think that one of the things that this research reinforces to me is that equal quick care in and of itself may not necessarily be what we're looking for if we don't also improve the care ecosystem. So the demands on parents, the demands on families and communities is exceeding, in many cases, their capacity to be able to actually manage them, and hence why kind of the private and public sector interventions are so important, because it's not just about equalising care, it's also about improving care. A rising tide lifts all boats, right? So we're going to go to questions from the audience in 5 minutes. So if you haven't added your question using the Q&A function, please do so now. But as kind of a last question before we do go to audience questions, just quickly from each of you, what is the most urgent action that needs to be undertaken, whether by government or the private sector or maybe the development sector in your country right now? So Aubrey, I'm going to go back to you first.
Yeah, so I feel like it's addressing the care needs of children with disability. It's really it's a race against time. It's really a matter that requires urgent action because there is a huge time element. So prolonging the problems in their, say, cognitive and other like functional disabilities or functional abilities, it would lead to even greater problems in the future. It's really a race. And I think another urgent action that's needed is the improvement of basic service delivery, especially in unserved and underserved areas. In the Philippines, we have this geographically isolated, I suppose, other like in Indonesia, you also have this because you have islands. So we have this geographically isolated and disadvantaged areas. These are very remote areas, and there are people there, and I suppose there are also disabled persons there, elderly, sick elderly, and others that need care. Because the problem really with family-based care is that they're okay if the member is not sick, but if there's a sick person, if there are these disability problems, the unpaid care work would really be really necessary for them. So I think basic delivery services in the unserved and underserved areas. Third one would be there has to be a resolution to the problem created with the mass migration of healthcare workers, including the out-migration of allied professionals, and also caregivers, because the caregivers that are the qualified caregivers in the Philippines, they're not here. They're somewhere, they're in other countries. So we also export social workers, of course, domestic workers, at the expense of the children and other family members left behind. There are also elderly members left behind. So health facilities and other care facilities and other care solutions that may be needed. They have all this difficulty providing care services because of the lack of qualified human resources. So those are the things that I think require urgent action.
Brilliant. And I can already see there was a question that I think you really answered very well, coming through from the audience there, right on that. So thanks so much, Aubrey. What about from you, Hong?
It's hard for me to actually pick up one specific issue as an urgent action needed, but I would like to say for the context of Vietnam, you all know that Vietnam has gone through a massive transformation for the administrative system and for the database system as well. Everything is just like going on so fast. And so that's why I think if you look at care, the care system is so complicated, right? And the problem now for the country is that if it's going so fast like this now, the first thing is to stop a moment and look back to reconsider and re-recognize proper roles of stakeholders, because that's actually part of the recognition in the 6R. It's not just about care roles, but stakeholders' roles in the care system, because that's the cornerstone for stakeholder engagement. If we don't define the roles of the stakeholders within that map, it's really hard to know how to engage each of them. Because one of the strengths and also the strength and also limitation in Vietnam is the very strong roles of the government. They have very strong leadership, which is good in some aspects, but also that would have kind of create the reliance, the psychology of reliance on the government to take actions. Then other stakeholders can follow, and vice versa. So that's a very interlinked barrier at the moment to really know who can do what, who can support the government. If the government knows that, if they identify that, they would have the policy to engage those stakeholders properly. And because if they can do that kind of engagement, then they can do the redistribution. It's a systemic issue. It's a redistribution of care work, of duties, of opportunities. I think the important here is the opportunities for others to contribute. And that's what the government needs to be aware of and kind of remapping what they need at the moment to actually empower other actors. We talk about that a lot, about private actors, but how can you do that in a consistent way and not just opening this and closing that, but like it should be on the agenda comprehensively. But if you want to pick up one specific thing, I would say that can be the standardization of public database for care and occupational support. We talk about occupations, like care work is a job, is an occupation, and so it's in the workforce. It's not like supporting like wealthier women or people to be in the workforce, but the carers themselves, even informal carers, they are in the workforce, and people like the public need to recognize that. So I think if you want to pick specific issue, that would be my pick.
Yeah, thanks so much, Hong. Absolutely, standardization is really, really critical, and that professionalization, absolutely. What about for you, Tari, kind of top priority action?
Okay. Can you hear me clearly, Alice? Because it's down really, it's raining really hard.
Oh, we can hear you fine.
Okay, cool. So Thanks for Hong and Aubrey for, I think I'm going to use some of your points because I see the similarities between three of us. So looking ahead 20 to 25 years in Indonesia, we anticipate care landscape that's complex and uneven. Families will likely remain as the main provider for care because of the strong cultural values and then also the religious perceptions, as I mentioned before. And then while relying on family is financially necessary, and maybe some people think it's good to save some money for other posts in the family, but it can also compromise the care quality when the caregivers lack training or resources. So paid care is often seen as the last resort, and these kind of idea, we believe, will delay investment in formal services. So we do have private care option, but mostly serve the middle or upper classes, and that also deepening the inequality. And then in central to urban areas, domestic workers remain undervalued, even though they are actually, based on our interviews, they have become, how to pronounce it? Like people will go for them, like hire them, because they can do the household chores. They can also take care of the older members of the family and the children. However, once again, we have to also remember that even in Indonesia, domestic workers still lack recognition as formal workers, and their basic labor rights are not yet fulfilled. So this underinvestment must be understood as a long-term issue. I have to say that strong political will is essential, because a healthy care economy ecosystem will require commitment and coordinated across sectors. Right now, our findings shows that the different bodies, government bodies, and then they already have like a care-related policies. It's promising, this kind of overlaps, but definitely we need integrated planning and also to involve, like private sectors, because depending on government sectors or public sectors all the time will not be sufficient for this big Indonesia. And then supporting grassroots advocacy as well, because we learn that the community are become so creative and resilient because they also set up their own care system. And then we also need them not only to provide care for their own community members, but also to raise public awareness on how important care work is and monitor how care policies or program done by the government and also private sectors is implemented. And I also want to touch a bit about the data, just like what Hong mentioned, because Indonesia already has this care economy roadmap and national action plan. So we go from here. That's what the research team recommends. Go from this roadmap, and the next step is government, private sectors, development sector, using these to build a coordinated strategy. Improving data, not necessarily, we don't need to, we don't always like do everything from the scratch, like doing new studies all the time, but using existing research, advocacy findings from civil society and development organizations, I think that's a must. Thank you.
Yeah, thank you so much, Utari. And I can see we have lots of questions online. So if we don't get to your question online, but you still would like to ask it, you can find our details. I'll get our team to share in the chat. our email, and you're very welcome to write to us, and we can chat further. But I'm just going to group a few questions together that have been coming up, and I think that there's a few ones that really struck me. So we were just talking about the private sector before. So one question talks about, there's the mention of a role of startups in addressing the care service deficit. Are there any examples of promising or successful startups operating in this sphere? And secondly, how much can be privatized? What's the limits? How should we encourage effective collaboration between private sector and public sector to provide equitable and effective care? Can I throw open to our panel? Anyone who wants to answer any aspect of that, maybe Aubrey?
Yeah, so regarding the startup, I found one, but it's an app-based technology or care solution technology that can be used. It's about matching. It helps match the providers with the ones needing care. So it's like how do you call that? Is that the Tinder, the one that's matching people to each other? So it's like that. What it gives is that it helps people find the right care provider. For the care provider, it shows what skills or what things that person can do, and then the app would allow these two to like converse. But of course, there's a fee. So I think that's one that I found. There are also quite a lot of local placement agencies for domestic workers working mostly locally. So this is not for like going abroad. So I think that's for me, that's an improvement, because usually we only have visible placement agencies for going for people who want to go abroad. So besides that, there are of course the telehealth. We were familiar with that already, but I think it's only very few of them doing this. But I hope that we'll have more. It would be good to know what results these apps or these technologies have had so far. So yeah, so I think that's the startups that I've encountered while we're doing the study.
Yeah, thanks so much, Aubrey. And I think, still there's, I think quality, kind of how you assure kind of quality and trust, and that reliability factor is still a concern, but the opportunity is certainly very, very large. Hung or Utari, anything you wanted to add on kind of private sector and the limits to private sector, or what they should be doing, or public sector?
Okay. Thanks. I think I want to add Aubrey's explanation on startup. There's also another thing about this, the research. As a researchers, many times we found it difficult to approach, potential key informants, and that include private sectors. That's another thing that we have to, to admit here as a transparency in doing research. But we managed to have one startup called Para Kerja as a participant for our validation workshop. And we were surprised to see that this startup is managed by young people, Gen Z, and then they try to meet the market with people with a disability who have skills and they need work, and they have some special skills, but using traditional channel they couldn't find job, and these startup by young people is very good to meet for them to meet potential employers. And then our community members also mentioned how they use technology aside from the startup thing, use technology to look for insights, for example, or information related to health. For example, like YouTube, TikTok, Instagram, it's being used by the young generation, especially Generation Z, because we talk to different generations, from the senior or baby boomers to Generation Z. And then, unfortunately, there is also some kind of gap here that we have to think about, that when everyone using technology, even the national health system in Indonesia using mobile application, the older generation, baby boomers and X, are feel that they are a bit left out because it's difficult for them to compete or to acquire the new technology. So it's like a two sides, this technology.
Yeah, thanks so much for sharing that, Utari. And Hung, given we've got 5 minutes left before I hand to Macy for our closing remarks, please do answer the question on private sector if you've got anything else to add. But I also wanted to throw in a question here that came up in the chat, which I thought was really good, which is, given the complexity of the care economy and the many challenges involved, what gives you hope that your country can achieve significant and meaningful progress in the next 5 years? And Aubrey and Utari, I might line you up to give us a really quick fire answer on that one as well. So over to you, Hung. Any thoughts on the private sector and what gives you hope?
Well, for the private sector, actually, I think like in Vietnam, also like Aubrey and Utari just mentioned about the startups via platform-based services. Mostly what I think is what I see is they are very good at networking, like connecting people. But there are also issues with technical skills and also vocational skills for those people to do the job properly. That's why one of the startups is no longer a startup, quite established at the moment, but one of the owner of a big platform in Vietnam that we talked to, he's trying to mobilize resources to develop an aged care, elder care services via that platform, but he's stuck for like years because it's really hard to get skilled people certified and to do the job safely. So it's another story. It's not like just go in and do household chores. So I think one of the idea I'm just thinking when listening to you guys is how to connect the one who need jobs with training centers. Like the training centers can provide those workers, like care workers, trained care workers, and that they can link that with the users in some way. I mean, yeah, that sort of thing. Another thing is about they can jump up into the media sector, like inclusive workplace promotions. That's one of the organization in which Macy has done. They're not a startup, but what they're doing is trying to demonstrate real workplace experiences for people with disability to know what it is at the workplaces, for their families to know, for the users to know. So what they are doing is kind of a media solution, but it works for their group of targeted support and those they are supporting. For your question is really big in the next 5 years. I think it's what we recommended in the report, that firstly, we need a comprehensive care economy roadmap, a strategy, and then a roadmap. And I really hope to see a stakeholder engagement roadmap for that, because I know what policy is made here in Vietnam is usually they list out a lot of public entities in the documents, but how about the role of stakeholders, role of civil society actors, mass organization? They are rarely mentioned within those strategy and roadmap with a defined role. So I think a way to do that is to have that kind of standalone stakeholder engagement roadmap so that they can base on that. And if they have that kind of legal basis, everything will be better, would be easier to facilitate and to make policies specifically for each group. And that will go along with resource distribution, coordination, and also for mobilization of resources and stakeholders who would do what within that whole roadmap of care economies. So I think in the next 5 years, the max I can expect is to have that strategy first.
Thanks,
and who can do what best for 5 years.
Yeah, thanks, Hung. And I think that, kind of the community as being a really kernel of hope, I think absolutely in terms of civil society actors and who is actually on the grounds doing a lot of this work and workplaces too, private sector. Aubrey and Utari, if I can ask you to boil your what gives you hope down into a word or three very, very quickly. So what gives you hope, Aubrey?
Yeah, so I'd really hope that there'll be more investments on care facilities, because when we are looking at how we're going to change these norms of family-based care, we must first have the care solutions available, because right now many of the areas in the Philippines do not have those facility-based care. And even the other care solutions, for instance, like home visits, or on-demand care, or the daycare for not just for children but also for the elderly. So I think because most of the respondents that we've had in our study are government representatives, and we've really tried to get their to get their understanding, their view of this, and we really want to have greater investment from the government, because the problem also is affordability. So once you have those care facilities, and I think the private sector can also also have a role to play in here. But I feel like the government should have should do first, or should do more in terms of the investments. There are opportunities, for instance, for local governments. They have what they call the GAD budget, and one of the best practice that we've seen in our study, one of the cities who have really excellent programs for elderly, for persons with disabilities, and even for children with disabilities. You really have to have this political will that Otari was saying a while ago, for you to use the available resources that you have. So they have used their GAD budget very effectively. They also have what they call the special education fund, the 1% that they are getting from I think the real property tax from the constituents. So I think it's really important for the government to do this first, and also to facilitate investment also. So in the report we have a discussion about how the national government, the policy in terms of incentivizing, because we have an experience before when we have talked to a good model resident care facility, wherein their problem really is understanding the incentives, or meeting the requirements for the incentive. Because if you want to put up the care facilities, resident care facilities that are high quality, there's some like requirement of some hectares of land that you have to occupy at the minimum, so that you get the incentives. But they don't have that if they're still so investments, I think that's what I hope for.
Investments. Really. Okay, perfect. Utari, I'm going to ask you to be very quick if you don't mind. Last 10 seconds, what it would be, what gives you hope?
Okay, definitely agree with what Hung and Aubrey mentioned. I just want to add specific to Indonesia, we already have care economy roadmap. So hopefully in the next 5 years, it's going on track, because the first 5 years of care economy, the plan on care economy roadmap is strengthening the data, and also mapping the actors and beneficiaries in the care economy system in Indonesia. Because by doing so, that means we go in the right direction, in our opinion. And we need stronger regulation, because this care economy map is a soft policy. So we need something stronger that can be applied nationally, and then can have the derivative regulations at the local level. The other thing is more campaign on recognizing the importance of care work, because once again, it's not only talking about the infrastructure, the buildings, but back to our home, the family, the household itself. The importance of care work in running the economies of the family, and then for the productive economy. Yeah. I think I will leave it like that.
Thanks so much, Utari. On that note, I'm going to hand over to Macy Angelina from Investing in Women to close us out today. And thank you again, Aubrey, Hung, and Utari. Over to you, Macy.
Thank you so much, Elise, and also for Audrey, Huang, and also Utari for the fantastic discussion today. I really appreciate how the team really tries to unearth the complexity, but at the same time gives us hope by highlighting the practices that are already done in each country to solve the care economy issue. I also very much appreciate the report's longer time horizon of 25 years. So it's not just about what are some of the pressing issues today, but what are some of the issues that we really need to pay attention to so it doesn't deepen and become a larger issue in the future. The other strength of the report to me and what's striking from the discussion is that when we talk about care economy, we can't just talk about the subsector like childcare or aged care or disability care, but the importance of weaving them together and seeing how it impacts women's economic equality, women's daily lives, and also everyone affected by care, because care is important to sustain humanity and therefore applies to everyone. The other strength of the report that I really appreciate is how the recommendations outlines in detail about the role that can be taken up by different kinds of actors, such as employers or businesses, communities, and also government and the development sector, as well as academia. So to me, the report really is an invitation for a further conversation about how different kinds of actors can really contribute to solving the future demand for care in a way that contributes to an equitable society. At Investing in Women, an initiative of the Australian government, we are responding to this through working with different ways. So one of them is by working with actors who do research on flexible work policies, for instance, among different kinds of workplace policies that can promote equitable care norms and at the same time support women to join and also stay in the workforce. We're looking at how policies such as these can be applied across workers from different backgrounds, socioeconomically, and also different kinds of jobs, and also across genders. So it promotes those values and norms that we have been talking about. We also work with businesses who are looking at different ways to look at how employer-supported childcare can be provided for their diverse workforce and developing different models, learning from it, and sharing the insights with a broader set of constituents. We also work with initiatives that try to look at how do we professionalize non-medical aged care in Vietnam, as well as a private sector company looking at how we can harness the role of community pharmacists to support caregivers in providing cares to their older family members. So there are many ways that at Investing in Women, we're looking at supporting this issue. And also the norms question, which came up in the Q&A and also in the discussion in the panel, is one that is very important to us, because without changing care norms to make care something desirable, redistributed, and taken care of by people from all genders, it's impossible to look at that more equitable system that we've been talking about in the panel today. And therefore, part of Investing in Women's work is also supporting local campaigns and community of practices who are looking at ways to really try and change, instigate and inspire this behavior change in the society in our different countries. On that note, I would like to also invite everyone who has been joining us today to click the link that has just been circulated in the chat box. We have a small post-event survey where we ask you to give us some feedback about what you find most striking from the research, what insights that you would like to have further conversation on, so that informs also our next steps in making this research matter and becoming a point of collaboration and partnership across our countries. So please do take your time to click on that link and fill in the research. And we will also circulate the full report via email after this webinar closes. So you also have the opportunity to engage with the findings, the examples, and the recommendations in more depth. So with that, I again thank everyone for joining us today, and especially the research teams in GIWL, PITS, SMERU, and MDRI for the excellent presentation and for starting this important conversation. Thank you everyone for your continued commitment in advancing women's economic equality.
Thank you all. And I think that all of the links for the report are in the chat, so you can find more information there. But otherwise, have a lovely rest of your day all. Thank you.